have a large malignant hemangioparasitoma compressing your frontal lobes.
Malignant?
Yes, but it's operable, which is good because if left untreated, this would likely kill you within a year.
Okay.
The tumor is probably why your father stopped being a dick a few months ago.
I knew our relationship had improved. I just didn't know it was because of this. So if you remove it, could that change my personality back?
Most likely.
Thank you, Doctor. I'm going to pass on the surgery.
My patient is refusing the hemangioparasitoma resection surgery that will save his life. I want you to talk him into it.
That's not how this works, Shaun.
It should be. You are more persuasive than I am.
Ask Glassman. He's removed more anterior fossa tumors than anyone on the West Coast.
But Dr. Glassman should not be doing any surgery until—
I agree, but I was overruled. If you want someone to change your patient's mind, Glassman's your best shot.
You are persuasive. Do you understand what will happen if you don't have the operation?
Yes, I'll be dead within a year.
And why is that preferable to surgery?
Haley was right about me. I was a terrible person. A terrible father. Never played with her. I hardly talked to her. I can't even remember holding her hand.
The Wizard of Oz. I was 5, terrified of the flying monkeys, but when I reached for your hand,
I pulled it away.
I never tried to again.
I don't want to go back. I don't want to lose this.
I don't want to lose you.
The brain is a funny thing. It wants to do the things that makes it feel good, get that dopamine hit. In fact, it actually can reshape itself as it continues to try to experience those good feelings.
So you're saying I might be able to stay this way?
Maybe. You work hard to be the best version of the person you want to be. I've had that fight.
You should listen to Dr. Glassman, and he has removed more anterior fossa tumors than anyone on the West Coast.
Hey, I have faith in you, Dad. You can do the work. You could stay a good man.
Well, like the patient said, I didn't want brain surgery, but the doctor changed my mind.
Was a dad joke?
And a yes.
If you do the surgery. I've heard that you know your way around a fossa tumor.
As you wish.
You need a rest?
No, just stretching. There is our house guest, having overstayed his welcome.
There's a lot of bleeding.
Vascular eclipse.
Must be a tear in the anterior cerebrals.
Now it's from the door feeders. As expected. And there we are.
Oh, bleeding stopped.
Nice.
No. Dr. Glassman, please tell us what the next step is. You hesitated. You need to say what comes next in the surgery.
Somebody please call security. Shaun, you are out of line.
Answer. Please.
It's,
We need to decompress the optic nerve. Proton dissectors.
Clinic artery embolization went very well. Your daughter should not need any more surgeries.
She'll need to spend the next few days in the hospital until we can remove her NG tube, get her back on regular.
What? Honey? What's happening?
Profoundly hypertensive.
Kenny?
Pulse disparity between arms. This is likely an aortic dissection. We need to get him to an OR stat. We need to place the graft to replace the descending and thoracic aorta.
We need 6 more units of blood? I did a full exam in the ER. I mean, the imaging was clear. There were no signs of dissection.
Trim the distal aorta. Must have started small enough to be undetected. His blood pressure gradually expanded the tear until it ruptured. Oh, there's a false lumen. It extends past the carotid. The graft won't work.
Oh, can you have one of your visions? Come on, Shaun, there must be something for his family.
He's lost more than half his blood volume. His brain has been underperfused for too long. Time of death, 4:36 p.m. Nurses put a chair next to the table for you, if you would like to sit.
Is it okay to touch him?
Yes, just don't remove the sheet.
He was just here. How am I gonna tell my girls? I don't think I can do any of this without him.
When my brother, Steve, died, didn't know how I would survive. He had always taken care of me, but I did, because someone else came into my life who took care of me and loved me. Now he may be gone too. It is very hard to lose people you thought would never leave, but you will be okay because you have no choice. When we lose people we love, we have to find a way to keep going for the people we still have. Take as much time as you need. I'm going to have a baby now.
You're back. How's the little girl?
She will be okay. How far apart are the contractions?
About 2 minutes.
Okay. It is time to start pushing.
Are you sure? I don't feel anything.
That's because of the epidural, but your prostaglandin E1 and E2 levels are at peak concentration for stimulating myometrial contractility. It is time.
I'll gown up and be right back.
I will refill your water bottle and get an extra pillow. Do you want a warm or cold washcloth?
Either is fine, but I need more time.
Delaying delivery can cause excessive postpartum bleeding plus an increase in bacterial infections. I'll get one warm and one cold.
Shaun, wait. Come here a minute. I'm scared. Really, really scared.
It is common for women to be anxious about the birthing process.
For 9 months, my whole goal was to keep this baby in my belly safe and sound and protected. And now it feels like I'm supposed to just shove my own heart into the world and let it walk around all exposed and vulnerable and so tiny. And I'm not gonna be able to protect him anymore.
It will be okay. Probably. I am very excited to meet our son.
I'm really excited too. Okay, let's do that.